Hey, what's up, everybody? Thanks for tuning in and watching the Recovery Clinic. If you haven't already hit that like button and followed our page, please do so now. Just click the title, The Recovery Clinic. It's going to be a great show today. If you don't know, my name's Jimmy McGill. Thanks for tuning in and watching. I am a man in long-term recovery from addiction, and what that means is I haven't put a drink or a drug in my body in almost 6 years. And this handsome son of a gun is Dickie. And he is just playing on his phone.
I like to keep him on his toes. Getting set. Hey, we went live. Man,
hey,
we just jumped in, didn't we?
We jumped right in there. Hey, if you don't know, Chris is also a person in long-term recovery, and he happens to be one of my closest friends.
Yeah, I kind of like this guy over here.
Yeah?
In case you didn't know, I celebrated a milestone last week. Celebrated 13 years in long-term recovery. It's one, you know.
Tell me about it. I want to know what 13 years sober looks like, Chris.
Well, each year you kind of go through this reflection 2 weeks up until, right?
Right.
And I'm just looking back, and I've really been in recovery half of my life.
Yeah.
Because I spent, 7 years prior to the 17, trying to find the relief from addiction. And
yeah.
And so it's, I was thinking about that, but really what I thought about this year is the pandemic and all of the people who have chose to take their life back during this challenging time.
Yeah.
My heart goes out to people who have never been to a recovery meeting, have never tried before to find recovery and build a foundation. And they're doing it in a global pandemic.
During COVID.
And we're going to talk a little bit about that with our guest today.
And hey, listen, if you're watching, instead of sharing the video, tag who you want to see the video in the comments. Let's pull them to us instead of separating us from other viewers who may start watch parties. Listen, it's important because COVID-19 did not stop addiction, right? Like, it affected a lot of things in Arkansas, all around the nation actually. But the dope house didn't close down, addiction didn't close down, overdoses didn't close down, and I guarantee you, no matter who you are, you know somebody that's affected by drug use, and right now is the time more than ever when they need to hear what we're going to talk about today, Chris.
Absolutely, and the message of the Recovery Clinic is, we do recover.
And if I can do it, boy, anybody can do it, I promise.
Sometimes we find ourselves in a little bit of trouble.
What kind of trouble?
Legal trouble.
I feel like this is going to target me.
No, it's not. It's I think some of the hardest math to calculate is the foresight of our current decisions, on the future impact of our current decisions.
Oh, yeah,
and so there was a time where I was in a car accident. I changed the doctor's prescription from a 1 to a 4.
You just wanted a couple extra pills.
I thought I knew better than him. He's like, didn't give me enough. And
if one to do it, two's got to be good.
That one little decision
affected your entire life.
A whole decade of challenges.
Yeah.
It's cascading effect. And
yeah.
I didn't get good jobs after they have been offered to me because I couldn't pass a background check, and it was difficult for a long time.
Right.
And got into school, got educated formally. And went through and started, I wasn't always focusing on that, but every once in a while it would come up.
Right.
And I even went through the expungement process. That thing was gone. It doesn't exist, right? That's what the expungement does. It takes away that decision that I've made, which is really incredible that I was able to get that done.
Right.
And then over the next few years, as my life kind of, continued to evolve, it still would come up every once in a while, and I was like, this has to stop. Mm-hmm. I just don't want this to come up. And someone suggested, why don't you petition the governor of Oregon for a pardon? And I looked that up on what to do, and I realized 95% of those requests get denied. I'm like, oh my gosh, that's crazy.
Yeah, you'll never get it.
Right. And fast forward, last week I got on the phone call with the governor of Oregon.
Saw that on your Facebook.
And was able to thank her for pardoning me. So it's kind of interesting because the pardon is basically forgiveness. It doesn't excuse you of the crime, right?
Right.
Legally. she pardoned me for an expunged crime. So she really pardoned me and forgave me for something that didn't exist, which is kind of neat to think about. So I got both sides of that equation.
Yeah, that's neat.
But that's what we have to go through sometimes. And it's not just a win for me, it's a win for recovery in the community. That right now there's viewers watching that are running into a wall. They're getting job offers and they're being denied. They're trying to find a way out and build this foundation in recovery and thrive in life, but those past decisions are still holding them back. So keep going. There is
Don't
hope,
give up.
and we do recover. I said all that to say we do recover. We continue to overcome the things. Our past doesn't equal our future.
Right. Definitely doesn't define who we are, and it doesn't have to hinder you. You know, it can. In my case, you know, and yours, our past actually became a pathway to a productive future. That was the building blocks that took drunk Dickie on a bus ride that landed you as the CEO of a treatment center. Mm-hmm. That's it.
I did a little skipping stone action.
Like how does that even happen? You can't say Chris doesn't have imagination, right? Like without imagination, you can't even see that happening, right?
No.
Like you go from being an overdosing drunk, I hate to use stigmatizing language, but that's what we were.
That's what I was called.
To being a CEO of one of the you know, I dare say one of the best providers in the state.
Oh, you can say that.
I can.
That's true. We've got an award for it.
You did. You
Provider of the Year, baby.
Yes, you did.
And it's not without our team.
Right.
And so, speaking of that, I think is a great segue into you know, introducing our wonderful guest today.
I'm excited about
the
it.
COVID pandemic has taken a toll on the health of thousands of Arkansans.
Yeah.
Both physical and emotional.
Okay.
Curtis Barnett,
Yes.
Arkansas Blue Cross and Blue Shield president and CEO, is here in the studio today
Right now.
to talk about. I think. Are you in the studio yet with us?
Not yet,
Curtis,
but he's
I'm
here to
here.
be.
Thank you so much. You have 2 million members.
2 million members.
And how many employees?
3,200 employees.
3,200 employees. And
Golly.
so you talk about a blind side with this pandemic hitting, on top of all of the other challenges you're already facing.
Right.
And then you have 2 million members to take care of, and then 32 staff members to lead through this.
Right.
So, on Thanksgiving Eve, why don't you talk about some of the silver linings that you found in some of your challenges?
Sure.
And talk to us a little bit about who you are and what you do.
Sure. Glad to. And first of all, it's great to be with you two guys. I've got to know Chris pretty well over the last couple of years, and have been to the treatment center, and you've taken me through there, and I've gotten to see firsthand the great care that our members receive, you know, from you and your team. And we're thrilled to have you here in Arkansas, and appreciate the work that you're doing. And Jimmy, you know, Jimmy is a cover person, probably is the right word to use. He was featured this past summer on Blueprint magazine, which is a quarterly publication that we've produced for probably a quarter of a century or more, and it goes out to a distribution of about 500,000 Arkansans, get that on a quarterly basis. And Jimmy's story and his journey was documented there. He was very forthcoming and shared with all of our readers, all of our members, and we were thrilled to have you as part of that. And I was saying beforehand that I've been CEO since 2017, so in these 4 years, that has by far been the issue where I've received the most personal comments from people, both written, some of those through email, but also when I just run into people and they said, hey, I read that article, I saw Jimmy on the cover, I read his story, it was so inspiring, please do more of that. And so it's great to be here with you today.
Let me make sure he's not floating up out of here.
Yeah.
Those are great.
Well, if he is, he deserves to. But Christian, that's a great question. And, you know, really as we were leading up to early March, when this really began to certainly blow up the way that it has, you could kind of feel the pressure building at that point. And I remember for myself, we were beginning to implement parts of our pandemic plan. And we've had a pandemic plan going back to the bird flu days of 2007. We worked a plan, developed it then, and every year we've continued to to adjust it, to update it, to make sure that it fit the current needs of our workforce, of our customers, and really the changes in technology and everything that's occurring. So we were implementing that in phases leading up to that. And I'll never forget, it was the last plane trip that I took. I was going to Washington, D.C. for a conference, first week of March. And I was just about to get on the plane out here at the Little Rock National Airport, and one of the channels, I don't know if it's CNN or Fox, was on at the gate. And they talked about that North Carolina had documented their first case of COVID. And it was someone who had traveled from Seattle to North Carolina on a plane. And that was truly that aha moment that, hey, this thing, before then it had really been,
on a plane.
yeah, well, not just that, but it had been confined for the most part in the U.S. to really the Pacific Northwest,
right,
from
right.
Seattle down to Portland and maybe Northern California. But that was really the first time that it really went national and went coast to coast just like that. And so before I got on the plane that day, I texted my leadership team and said, implement the full plan. And so we went, full plan at that point, and really began for a series of weeks. We worked on pretty much, from 7 in the morning till 7, 8, 9 o'clock at night on COVID-related issues. And so for our members, that's where our first thought always goes out to them. And we knew that they would, have questions. Do I have COVID? What if I do have it? Is it covered? How will it be covered? So very quickly we said that if you need to get tested and if it's ordered by a physician, then we're going to cover it. And we're going to waive the copays for doing that. If it is determined that you do have COVID, then the treatment, we're going to cover that as well, and there won't be any cost sharing for that as well. So that began to give them peace of mind right away that, hey, if we're affected by the pandemic, we have the coverage, we have the security that we need, and really what they hope for and the reason that they buy insurance. The other thing that came up very quickly was, okay, how do I continue to receive the care that I need? Mm-hmm. How do I keep getting care today? Prescription drugs is always a question mark there. So a lot of times health plans will limit the number of prescription drugs that someone can get, maybe to a 30-day supply in most cases. So we relaxed those edits. They could get a full 90-day supply to get them through social distancing, get them through isolation. And then we implemented telehealth in a way that we've never done before in our industry, within our company. The providers embraced it in a big way. And we really saw almost overnight the use of telehealth just skyrocket. And so we implemented it not just for professional telehealth companies who provide physicians and all to do that. We went out to our community physicians and providers and licensed social workers and advanced practice nurses and professional counselors, and we went out to them and said, we will cover your services, whether it be for physical or for mental health needs, through telehealth. We're going to waive the copays for that as well. And we're going to do that, through the pandemic. So we've had that in place all along as well, and that's been just a major benefit for our members as well as for the providers as well.
So right around that time, I'm grateful for your SNAP leadership and getting that plan executed, because right around that same time, we're seeing triple overdose rates.
Yeah.
Or Narcan. I mean, we don't know if that's an official
overdose
rate. We
overdose
know Narcan
numbers aren't going to be right.
Narcan distributions have tripled.
Triple. Right.
And so right around that time, these people need a place to go to find help.
Yeah.
And did you guys see an increase at Blue Cross in people seeking mental health and treatment?
Oh, no question. And we saw it early on, but it's been pretty steady throughout all of this. And probably if you think of the number of claims that we get for services, claims that need to be reimbursed, or a customer service call, kind of the number that keeps coming up is 10 times higher than it was prior to the pandemic. So that's what we see, the number of claims we receive related to behavioral health or mental health, as well as calls into our call center as well. It's about 10 times higher than it's been, and that number has stayed pretty consistent throughout. So, talked about telehealth. At one time, over half of our total claims were all telehealth claims, because so many of our providers did such a wonderful job getting ready to treat COVID patients that they had to defer and delay a lot of care, especially non-urgent care during that time period.
Yeah.
So many of them were getting their care through telehealth. So at one time it was about half of our volume. Now it's come back down to about 25%, but about half of those claims are for mental health or for substance abuse issues that we're dealing with today. So still a lot of use for that. We've received a lot of great comments from those in the mental health community who are providing treatment, really expressing their appreciation for being able to provide that service.
Yeah, I mean, telehealth is similar to what we're doing today with the recovery clinic, using social media to continue bringing access to people who are looking for relief.
Yeah.
Have you heard anything about telehealth and
Yeah.
from friends, family, community members?
Well, yeah. Peers use telehealth.
Yeah.
No, we video health, telehealth, whatever you want to call it.
Right. Yeah. All the training. Yeah.
right.
Supervision. And
Yeah, long distance supervision, all that. So
it's an amazing rollout.
It is.
To witness, and not just from your industry, but even Jimmy and I, the 12-step community. You know, we at that time we're like, okay, we can't go face to face. It's not worth the risk. And then they were completely shut down. To see all of that shift to online was incredible.
Yeah.
So
Quick.
if we're looking for a silver lining,
No
there
question.
it is. That, you know, we didn't sit around and wait. We continued bringing
No question.
the message of hope
No question.
and the care that people are looking for to people who are hurt.
Yeah, absolutely.
And I do want to talk about one other, maybe more subtle silver lining that's
Okay.
occurred with all of this. And I think today, as we relate to one another, we probably all assume that you've been affected by the pandemic in some way, especially from a stress or maybe anxiety or something like that. So the rule now is more of you've struggled with this and dealing with this in some way, and that's not the exception anymore. It's the rule. Whereas prior to the pandemic, the rule was probably considered that I don't deal with these types of issues. It's the exception who is somebody who may be struggling with stress or mental health in some way or the other. So we've kind of flipped that since the pandemic started. And I think it's a subtle thing to note, but I think it's an important thing to note, because as we get beyond the pandemic and we think about the future of healthcare going forward and the importance of good physical health and good mental health and that whole person, bringing those two things together, that's something I hope we don't lose sight of. I hope that's something that we can maintain as a state and as a country and as a society going forward, that we recognize that you're not healthy if you're not mentally healthy, and you're not healthy if you're not physically healthy. You need both of those to come together, so let's support each other in that way. So that's another of the silver linings, a little more subtle, but I think it's one that's just as powerful.
I think it's absolutely that. We need a buffet of resources available. We don't, I mean, sometimes you got to meet, I mean, not sometimes, I believe we have to meet the person where they're at,
That's correct.
not tell them to fit our mold.
That's right. That's correct.
Sherry, thank you for the comment, says, we use telehealth at Recovery Lighthouse, and it's been a lifesaver through COVID. I think she's in Missouri.
Yeah.
Yeah.
Yeah, the whole nation's using telehealth.
Yep.
My doctor appointments are through telehealth, everything. So.
Yeah. So speaking of, I don't know if you're familiar, but recovery community organizations kind of talk about what that holistic approach to the person, where, you have a person in recovery, they can go to a recovery community organization and be led to different resources. If they don't have insurance, well, they can start to look at that. If they've got a court date coming up, there's people there to walk them through that process. If they're interested in a credential, they can start looking at college.
Yeah.
And those are super critical to the recovery
RCOs.
process.
Yeah, absolutely.
Yeah.
Yeah. They have, we've only got one in the state, which is Wolf Street.
Okay.
But, an RCO is driven by people in recovery, governed by people in recovery, and they're completely non-clinical.
Right.
So, but what they do is they offer, most of them are funded through their state's SSAs or some form of their domestic 501c3s, right? And so they go in there regardless of insurance, regardless of your financial stability. When you call, a lot of times, and I can speak for the drug director when I say this, a lot of times one of his main pet peeves is we've cold called a lot of treatment centers, right? Pretending to be the client who needs help. And so the first question is not, well, what's the problem? You know, the question is, what type of insurance do you have?
Yeah.
And there's a problem, you know.
Right.
And so with an RCO, the question is, what's the problem and how can we help?
Tell me about what's going on.
How quick can you get in here? And once you get there, you get free peer services.
Right.
And that peer starts, even if you don't have insurance, the first thing the peer does is starts getting you insurance, and then starts getting you connected to places who will take you. And then if you qualify for state funding, then they immediately start it and then start working on the insurance policy part, right?
Yeah.
So, yeah, they're vital.
Exactly.
You know?
Well, speaking of mental health and taking care, self-care, Jimmy has given me orders this afternoon to unplug because I haven't.
He's grounded. He's grounded.
And so he wants me to go do a bath bomb and just really
I didn't say
meditate.
a bath bomb. That's not what I said. I told him to go take a bubble bath, it was a bubble bath, Ricky. Put some incense on. Turn your phone off. Listen,
But
That's enough.
they're going to be sharing, like they're going to be calling me to make sure I'm not answering though.
No, it doesn't matter. Like, Chris, all you do is pour into people. You are depleted. You get depleted, you have to recharge.
I hear you.
You know what his deal is, Ricky? Is he's really good, folks, at telling me what to do, but not applying that stuff to himself. He's good at guiding other people.
I can see you real good. It's hard for me to see myself.
But that's where the accountability of recovery comes in, Curtis.
Well,
if I'm in a room with 14 people, I can only see 13 of them.
Well,
If I'm one of the 14.
What I was going to say is I appreciate his order.
Well, if you appreciate it, go do it. Unplug, turn your phone off. Don't
To
call
be-
Curtis. Don't call Jimmy. Don't text Ricky about the show.
To be continued. We'll see.
What that
I'm committed.
translates to is, I'm not going to do it. I'm going to spend all
I can't
weekend,
wait.
Thanksgiving, obsessing, worried about natural state recovery, worried about hiring and delegating.
Worried about Jimmy.
You ain't got to worry about Jimmy. Jimmy's turning his phone off and
Well-
going to eat turkey.
What I was going to say is thank you for the order, and I want to hear from Curtis how Curtis takes care of Curtis.
Yeah, Curtis got a big job,
And I
too.
wanted to let you know, you do it huge. And your number one fan's in here today with us.
Oh, she is?
Yep, she's in here. I've seen her comment.
Paula, is it Paula or is it somebody else?
Karen.
Oh, okay. Well, I've seen.
Paula's number 2.
Okay, I haven't been watching all of them, but I've seen Paula comment like 4 or 5 times. I did see a Karen. Yep.
Yeah.
Karen. Oh, your wifey.
Yes.
Okay.
Well, let me say hello to Karen and to Paula, but Karen first. So, good to see both of them.
No, but really, I mean, what we're talking about is serious, and while we're able to laugh is good. I mean, that's part of it.
Yeah.
And so how do you and Karen kind of share especially coming up on Thanksgiving,
Yeah.
in a new world in which we live in.
Exactly. And probably as I think back on these last 10 months, it's like most things, there's been good and bad. Probably the good part has been, I used to have a pretty heavy travel schedule. And I've not had that during this time period. So I've been able to spend more time with Karen, and we spent a lot more time together. And we're big streaming TV fans.
Mm-hmm.
I mean, we've got our favorites, and we spend a lot of time doing that, and like to spend time up at Greers Ferry Lake and have relaxing time up there. Our son graduated from college last December, and he's taking a little time off as he gets ready to graduate school or law school, but he's moved closer to us as well, so we've got to spend more time with him. So family time is absolutely critical, for us. I do like to run. Well, I don't know if I like to run, but I do run. But I think, Jimmy, you're a runner, and you've really taken that on. And so I do that, and that helps keep me fit. It's a big way to deal with the stress and everything that you're dealing with. But we were talking earlier about our employees, and I try to do a video blog out to them about every 2 weeks. Doesn't quite hit that way, but talk to them about a number of issues. And I have to admit, this summer, with everything that was happening, we were certainly dealing with COVID pandemic, dealing with the economy, we're dealing with social unrest, following the George Floyd, and everything that was just, hitting at that time. And I'm normally a news junkie. I mean, I read the Arkansas Democrat Gazette cover to cover every morning. News show in the morning, couple in the afternoon,
Jimmy's
and so
issue.
forth. Jimmy's issue. That's exactly right.
That's a good one.
And to do that, but I have to admit, for a period of time this summer, I went through a blue period. I mean,
Yeah.
it was just,
Oh, yeah.
it was too much.
We all
It was-
did.
Yeah, it was
We
just
all
too
did.
much. And I had to, push away a little bit. So I got to where the only thing I would watch was the governor's press conference, at 1 o'clock every day, and kind of skim the paper, and then would just spend time with family. And that helped me tremendously. But I knew a lot of our employees were feeling the same
yeah.
way. There's no question about
It was
that.
just
and
sad.
I was hearing from them
No
about
offense,
that.
Ricky.
Hearing from them about that. So one of my video blogs, I talked about that. I talked about my own situation and how I was feeling
That's so powerful.
and what I was doing about it, and encouraged their use of our employee assistance program and the resources that we make available to them. And so many employers do that, and other organizations. And I do encourage people, please take advantage of those resources. They're there for you. They're there for your family. They help. So please do that. And I have to say, that video blog, I got more, probably the second most number of comments I've gotten from any that I've done, where people appreciated hearing that. They appreciated knowing that we're all going through this, and we're all going through it together. So let's band together and let's pull together, and let's survive together.
Yeah.
Let's thrive together.
You shouldn't be an island of one.
That's exactly right.
And it's hard, there's power in numbers. So will you talk to us a little bit about what we've seen in the, with the kind of the critical mass of the opioid epidemic, when we started seeing all of those numbers just hit,
Right.
and everyone started to, okay, something's out of control here, and everyone started looking at prescribing rates, treatment, what is quality, evidence-based, what are these things? How has Blue Cross kind of navigated that evolution? Because I think what we're seeing, when the dust settles, we're going to be in a new landscape of treatment.
Agree.
And how we approach the substance use disorder and addiction
Absolutely.
medicine.
That's right.
Because what we're talking about is, blending clinical treatment, a lot of times recovery housing, and life skills training, which has the non-clinical part with
Yeah.
peer
Peer
recovery, which
peer
really,
recovery.
what you were talking about, really ties a bow on holistic approaches and modalities. So, back in like 15 and 16, we started to see, that's when everything started happening. And have you seen a change in your policy and how you approach addiction medicine and behavioral health care for members seeking treatment?
Yeah, I mean, I think we have, and I think part of it comes from, as we've gotten, obviously, more exposure to it, we've understood it better. We talked about Paula Cunningham. We have somebody within our company who is one of the most passionate and effective advocates for treatment, especially for medication-assisted treatment, than anybody in the state, maybe in the country.
Yeah,
And so she helps us on a daily basis, really understand that and the kind of work that we need to be doing and how we need to be thinking about this issue. So, we went through a period of time as this really began to gain, national attention. If we weren't talking about COVID so much today, obviously you guys know this well, prior to the pandemic, that was the #1 healthcare issue as a country that we were dealing with. And we still are. It's just a little bit it's just a little bit underneath right now. And so we've gone through a period of time for how can we really prevention, for lack of a better word. So more edits, more limits around the number of pills that can be prescribed, the number that can be dispensed. And so how do we begin to bring that down? We began sharing information with doctors throughout the state on their prescribing habits, and many of them had never seen that information before. What are their opioid prescribing rates? How does that compare to peers? How does that compare to maybe what's considered a best practice? And a lot of times, that kind of education goes a long way, and say, I had no idea, I didn't realize that. What can I do?
I have to interrupt because there, in the 12-step community, the process, the 4th and 5th step is like we put it on paper and we're like, oh, I didn't know. Okay, so that's exactly. I mean, basically they did an inventory.
Yeah.
So we kind of worked through that, and then we went in more to how can we help with treatment, and recognizing that just clamping down is not the answer. That in some cases that's going to push people to go into other directions, and certainly we didn't want to do things that encourage people to go into synthetic heroin and things like that, which you guys know those issues much better than I do. And so began working, UAMS in particular, on you're probably aware of AR Impact and the program that they have out there. Our company helped fund that and helped get that started. And what that is an opportunity for really physicians from around the state, providers from around the state to have access to experts at UAMS, pain management experts, doctors and pharmacists and other healthcare professionals, and they can present complicated cases to them. So these are people who have an opioid use disorder, a problem. But they also have pain as well. And what are my options? How do I deal with this? And they can present that case to them through teleconference, and so they can be anywhere in the state and present that to them and have rich access to expertise to help them work through those problems. So we got involved with that, again, through Paula, through others in our organization. MAT, medication-assisted treatment became very important to us, still is, and what can we do to be an advocate for that? And so we began funding some continuing education for doctors to help them understand really what it is and what it isn't, because there's been a stigma around MAT, even within the provider community or the physician community, and help them understand that. And so really some conferences and some programs around that. And then also working with UAMS again on what can we do to provide the additional training that doctors need to get that DEA waiver so that they can prescribe Suboxone and some other types of medications. And so we've been very active in that space as well. But a couple of areas that I'm particularly proud of has been, you've mentioned, I think, Director Lane a couple of times, and we've been able to form a bit of a relationship with him. And we had an opportunity a couple of years ago around Narcan kits. And really, this is before some of the federal funding became available, and looking for a way to get those in the hands of first responders. And so we had a conversation with him. We funded an initiative working with him, the Arkansas Criminal Justice Institute. At that time, it was, $125,000, over 1,100 Narcan kits, mainly in cities around our state where there are college campuses, where there was a lot of additional risk associated with that. Got that out there. We've had some subsequent funding through our foundation to provide for Narcan kits. And even today, we do something called a mini grant. And I can talk about our foundation here in a few minutes if you'd like for me to. But we have mini grants for up to $1,000 that are really easy for organizations, nonprofit organizations to get. And they can use those, police departments, city governments, others, to get Narcan kits and have those in the hands and in the vehicles of their first responders. So that's something we've been very proud of. Is to do that. And so, it hardly, maybe not a week, but a month goes by that we don't hear from the broader community about a life that's been saved by that. Now, we've not saved any lives. We've not done that. We certainly don't take credit for it.
You've contributed.
But it's something we take a lot of pride in, that we've been able to help in some small way.
People, especially in an organization of your size, are still afraid of Narcan because they have these certain misconceptions and great stigma. No Talk to him about what we just found out in the whole country overdose rates. There's 5 states that actually declined.
Absolutely. So we were the only state in the double-digit percentage
on
rate.
decline.
Wow. That is wonderful.
And that's because we've flooded the community with Narcan and making it accessible. Part of that initiative
there's a lot more of it. Narcan doesn't get all the credit for that.
Of course not. Of course not. But that's part of it.
Contributor. For sure, but when you start talking about it, it's not just Narcan.
Of course not.
It's a lot to do with our treatment, our prevention teams, our recovery team. Peer support is a huge part of it. And so that's a question that I want to kind of dig into, right? Like, so we talk about evidence-based practices, which you guys mentioned a while ago, and in 2007, Medicaid deemed peer recovery one of the most substantial evidence-based practices, right? And that was almost, 13 years ago. And so at this point, all we've done is collect successful data. And Arkansas having a model that is more intense with growth for the peer support. We just published a big thing about our 10 peer supervisors in the state. So it actually takes you about 2.5 years to reach supervisory credentials, right? Now that's recognized by both ASACB and NADAC, okay? And so you go through
I don't know what NADAC is, but
so you go through the ASACB is the Arkansas Substance Abuse Certification Board. And so you go through the core training, and then you get 500 hours of learning. You test. It's a 75 question test. You've got 2 hours to do it. Then you can take it a step further and go get your advanced credential, which is an additional 500 hours, an additional 75-hour test, an additional 80 hours of class time. And then you go on after that test. So by now it's taken a year and a half or so, right?
Right.
And so you go a step further and you get your supervisory credential. And so we're the only state that's ever done that career ladder. And so when you start talking about evidence-based practices, all these other states, you know, substance use peer recovery is Medicaid billable, and in a lot of states, third-party insurance will cover that. With Arkansas having such a robust ladder and truly complete circle and continuum of care from all the way across
Right.
the services, what would it take for that non-clinical service that is recognized by the federal government on down as a highly evidence-based practice to be covered by third-party insurances in Arkansas?
Yeah, and Jimmy, obviously I'm not as familiar with this as you are,
right.
and certainly, I think the first step is to share, similar to what you shared with me just now, and
Right.
To make sure that we do have a better understanding of that. I think, you know, through the work we've done over the last couple of years, I think you found where we try to be open-minded, certainly
Yeah.
where we can.
Yeah, you guys definitely are killing it.
And so, again, I think that's the first step, is let us sit down, let's talk about that a little bit more and see what we can or can't do in that situation. I think kind of a point maybe, Chris, you were alluding to earlier is what is going to be different after the pandemic.
Yeah.
And I do think that we've been in a period really since mental health parity as an industry, where at that time, you know, it took the government to force us to cover mental health illness at the same level as physical health. And we've gone through a period of time where we said, okay, we're going to manage that, you know, through utilization management,
Right.
and there's still value in that, and it's still important that we do that because we have to make, you know, health care and health insurance affordable. But we are shifting more now to, instead of tightly controlling utilization and avoiding it, what can we do to make sure that we welcome it and we include it in those cases? And so I think you're going to see that not only for our own company, but others in our industry continue to take that position going forward, because again, we recognize that whole thing that I talked about earlier, it's that whole person mindset.
Yeah.
And you've got to be healthy physically and mentally. So the kind of way that we've done business in the past is not going to be how we do it in the future. I can't guarantee we'll make the change you just described, but I can guarantee you that we'll look at it with a very open mind to see what makes sense.
Well, and that's all I'm asking for. Like, so it's just like with any of the stuff with peer support. There's a reason it's the hottest topic in the nation.
That's right.
Right? Like, I'm a firm believer, if you get in a room with Director Lane and myself and let me present data and evidence, it's undeniable. You know, at this point, we've got success stories this high of people who, and like, so I think about New Directions Behavioral Health, right? Like, they employ peer support. And my wife actually worked for them, which is an insurance agency, and they covered peer support, right? And so, but in the 2 years that she worked with them, I personally watched her, and without saying any names or violating any HIPAA stuff, I watched 4 or 5 different cases where people were in and out, and insurance is constantly paying this treatment bill, and they're still sober today 2.5 years later. Right. You know what I mean?
Right.
And
because her role was kind of to reach out and check in on people,
Her role was, she's going out in the community, working out with them at CrossFit. She's going to AA meetings with them. She's going to NA meetings with them. She's getting them implemented into the recovery process after release from treatment. So she was introduced to them during the treatment process through care transitions or whatever, right? Like, they send them in, and you meet this peer. And she's basically comes in the treatment center and says, hey, I'm a person in recovery just like you, and I've been sober for 7 years, and if you want to talk, I can share some stuff that made my life what it is today from where you're sitting.
Yeah, and this is a benefit of your policy.
Yes.
Which is crazy.
And so those that opted into that, all of a sudden you guys aren't spending that money on them being readmitted into treatment.
Right.
And so when you start looking at cases like that, and I'm not gonna get in their business, right? But I did see a report, and in 1 year it was substantially in the millions of dollars that they saved through 2 peer support specialists. And so, you know, when you look at money's the motivator at the end of the day, and if you're talking savings, you know, I don't see why it's not embraced.
Talking about, you know, the economical impact of addiction is in the billions.
That's right.
And another initiative that I've seen you be a part of is the Together Arkansas initiative with the state chamber.
Yeah, that's a good one.
And when, you know, it's kind of modeling after you sending out messaging to the doctors.
Right.
Now we're looking at employers as a whole in the state,
right.
which I love because, you know, how many hours out of our life do we spend at the job, right?
That's exactly right.
And so an employer can be that lifeboat.
Yeah.
And but I mean, we need to know where to send the lifeboat. And so the Together Arkansas initiative it bridges that gap. It allows employers to be educated on how to help an employee that could be suffering from addiction. And so tell me about what made you attracted to that and why.
Sure,
and how you're helping.
Yeah, Chris, and I give the credit to Randy Zook and his team, Shelley Short at the Arkansas State Chamber, and you make a great point, and we've talked about this in different ways throughout this discussion. I mean, really helping somebody with their behavioral health or addiction, it truly is that it takes a village, you know, to be able to do that, and we've seen that over and over again, and we've seen the payers involved, the providers involved, the families involved, certainly the patient involved. But there was a missing piece out there for a lot of people, and that's the employers. And it wasn't because the employers didn't want to be involved. It's just in many cases they didn't know how to become involved, especially when you think about small employers, mid-sized employers, who maybe have limited administrative resources, especially human resources, where a large company, you might have individuals or a department who takes responsibility for that, and they have very robust programs that they push out, and they understand the value and they work on it. So Randy and his team came to us and said, you know, we think this is an area where we need to engage the business community. They want to be engaged on this. They want to help. They want to play an important role.
Yeah.
And how can we help them? How can we do that? So, I mean, it didn't take 5 minutes, you know, talking about it where we knew we were in.
Yeah.
AFMC, the Arkansas Foundation for Medical Care, is another organization that was a part of this from the very beginning. They are also deeply committed to it as well. And so the three of us began to put this together, and they said, okay, you know, as we build this out, it has to be practical. It can't just be, you know, pushing information. What can we do to give them real tools to help them make a difference and be effective? And so our team, working with the State Chamber team and AFMC, began working through and developed really 5 modules that are available. They're available on a website. They're also, we push that information out to employers who express interest as well, but it's free to them. And these are like 15-minute videos and sessions that are done by real-life Arkansans and people who are dealing with this every day. And the first one is really just to educate them about the opioid crisis and what we're dealing with, because a lot of them may have seen it in the workplace in 1 or 2 cases. They've certainly heard it on the news, but what does it really mean, and how is it probably affecting them, their business, their safety, their quality, their customers? You know, what does this really mean? So
it's impacting all that.
Exactly. A second one is how do you really build and put together a legally sound program, you know, for a workplace? How do you do that? How do you put that together in such a way that they could feel confident if they went in this direction, that it met all the federal, state requirements and everything associated with that? A third one was more of almost from a human resources standpoint, the actual policies, and so that address safety and absenteeism and things like that. And how do you take those and fit those to the operation of a culture of an organization? Because you may have a family-owned business, very different than one that maybe is owned by external investors or, you know, trucking company from other type of companies. So really a way that they could customize it. So that was a third module. A fourth one was around drug testing and how do you do that, when it's appropriate, how it's appropriate. And then the fifth one is, where do you go? Once you find out you've got a problem, kind of, Jimmy, to your point, what are the resources that are available to you? And one of the things we took the opportunity to talk about in that fifth module is MAT, is medication-assisted treatment, and what that is, again, and what it isn't, so that they would feel, have a good understanding and feel like they could embrace that for their employees. And if their employees went to a treatment center and were treated in that way, how that's very positive, and how really that is the standard of care and what it should be. So don't view it, negatively in any ways. And so push that information out. It's been well received. Again, I think it's another area we've gotten a lot of good feedback where it seems to be making a difference, and we're very proud of that as well.
Yeah, I mean, I'm all in with the Together Arkansas initiative. I think it's one of a kind.
Yeah.
And hopefully
Didn't you just
other.
do a video for that?
If you're going to bring it up, I'll talk about it. Yes, I did.
Well, we do.
Well, then.
We've had Chris, we've had Director
Kyle Brewer.
Lane, we've had Director Lane, we've had Attorney General Rutledge, have all done endorsements and talked about that, and we're thrilled to have their support. And certainly, and I should mention also, Walmart has been a sponsor of that as well. They've been our digital sponsor, and so really the work that we're able to push out to people, they've helped sponsor that, and they've been a great partner as well.
I love that collaboration, right?
That's
like whenever. One of the things I find myself saying, Curtis, a lot is when we look at each other as competition, we miss the chance for collaboration.
That's right.
And so I love seeing the working, the employers coming together and learning together, and then finding a solution together.
That's right.
That's the cool part about that.
Together. We recover
Arkansas.
together.
Together, Arkansas.
I mean, there's something to that, right? Power.
There is.
So anyway,
I love
and
it.
being open-minded, like Curtis says, is super important because, it's one of my major inabilities when I got sober was
Closed-mindedness.
Yeah.
Well, you can't graft a new idea with a closed mind. Now you're so open-minded, your brain might fall out.
Albert Einstein, he said you can't fix the crap in your head with the crap in your head.
Is that where that came from?
Yeah.
I thought that came out the big book.
No. I mean, I've
just
tweaked it a little bit. Tweaked the quote a little bit. Yeah, definitely. Yeah, Alfred Einstein, you know him?
Yeah. I know him. Crazy hair guy.
Yeah. Parker Blake says, I love seeing the way this conversation supports and defends the well-being of some of our city's most vulnerable families. What a great conversation. Which, thank you, Parker, for that. Curtis, we always give you the last word. Is there anything you want to tell our viewers, anybody who's watching? Might even spend a little bit talking about the foundation, because there's, a lot of times, addiction comes through, steamrolls someone's family or community, and then, people get passionate, turn that pain into purpose, and build a little nonprofit out of it.
That's right.
And maybe they're looking for some funding opportunities, and you have a big one.
Sure. Well, let me wrap up with a couple of things. First of all, I want to build on what Jimmy just mentioned, and by talking and getting together, it's just amazing just how often we find out how many things we have in common rather than different when we're able to do that. So I appreciate you guys, having me today, having this forum for our state. Ricky, good to see you and have you part of this as well. This
Ricky!
is an important thing.
We get to talk about
handsome
Ricky.
guy on the side.
To do, and so thank you for doing that. And one thing I like to try to do is when I have this opportunity to have these types of conversations and interactions, my hope always is that when I walk away, that people who I don't talk to or see in our company or our industry on a regular basis, that they discover or learn something about our company, that we're thinking about things and that we care about things that maybe they didn't think that we did.
Yeah.
And I think that's an important thing. I think they have a view of a health plan and a health insurer, and hopefully we're helping to change what that may be. So that's one thing I want to build on. But a couple of other things. You mentioned our Blue and You Foundation for a Healthier Arkansas, and we formed that in 2001. Over the past 19 years, we have funded about 2,000 health improvement initiatives in all 75 counties of Arkansas, and about $40 million in grants to nonprofit organizations have resulted from that funding work. A lot of things we're very proud of, the impact that we've had on people's lives, on individual communities. Probably, I look back just over the last 2 or 3 years as I did a little preparation for this show, and probably anywhere 20, in some cases 25% of those initiatives and funding go to behavioral health related issues, and addiction being a big part of that. AR Impact I talked about earlier, the Narcan work that we did with the state, all came through that avenue. And so We do have two forms of grants. One is we have what we call our regular grants from $5,000 to $150,000 is the range. And nonprofit organizations can apply for those. And July 15th will be the deadline for that of this coming year. We have done all of our funding for this year, and as you might expect, it was really dominated by the COVID issues, and we really supported things in that area. And so, but please keep that in mind as you think about the work that your organization is doing to apply for one of our grants. We do have the information out on the website. I don't have that web address in front of me right now, but encourage you, just Google Arkansas, the Blue and You Foundation for a Healthier Arkansas, or Blue and You Foundation, and you'll find us. But we also have a mini grant program, and we do about 250 to 300 mini grants per year. They're $1,000, and if you think about especially smaller organizations or again local governments, $1,000 can mean a lot to them, especially if they're doing Narcan kits, stop the bleed kits is another area where we've had a big impact. Where if you have an active shooter situation, we've allowed schools and city governments and all, they've been able to purchase these kits and again save lives by being able to do that. And so that's been important as well. So March 15th is the date, and that's a very streamlined process. It's a simple form. They can apply for a grant. They usually get a response back in 24 to 48 hours, and we get the money out to them as quickly as possible. So I venture to say I don't think anyone has done more to funding for health-related initiatives in our state than our organization has. The last thing I would just leave you with is at the end of the day, all this is about people.
Yeah.
It's about the people that we serve, and it's about the people in our organization who serve them. And one of my favorite departments or teams in our organization is our social work team. And any chance I get, I spend time with them and I ask them about the kind of issues that they're dealing with. And they see firsthand the kind of issues you guys are talking about. And they see people who are struggling with addiction. And they see they may be on their first, second, or third time. And they turn to them in our customer service tab. They're that front line in many cases as well. They're that phone call that people get. And that people make, and they get that, and they begin to work with them to help them, not just tell them what their benefits are, but these are what your treatment options are. This is how we can help you. So to have access to people in your organization and other providers in the state, that when we get that call, we can pick up a phone and say, we've got somebody who's really in an urgent situation. Can you help them? It's important to have that because it's about people helping people at the end of the day, and we've got some wonderful people in our organization who are doing just that, and I couldn't be prouder of them.
That's great.
Awesome. It's good.
Hey, drop the mic on them. Happy Thanksgiving, everybody.
Happy Thanksgiving.
Please be safe. Jimmy?
If you struggle through the holidays, and I want to say this real quick, I know we're pressed for time, but we tend to see a return to drug use rate on a daily basis throughout the holidays. And so if you get overwhelmed with feelings and emotions, depression, please inbox us at the Recovery Clinic. We can't recover by ourselves. The thought that we can is a myth. Willpower is a myth. Pick up your phone, call us, message us. I guarantee you we'll respond. Go get a cup of coffee, anything. Just don't pick up and use. Call us. We love you guys, and we'll see you next Wednesday at 11.